Hi, my name is Kenny Nguyen, and this will be my video on fieldwork for like an assignment. So this is a reflection on my current fieldwork number one. So the first question was for level one fieldwork mental health. What were two to three key strengths identified by myself, a supervisor, or a peer? So during summer 2025, I attended St. Madeleine Sophie Center in El Cajon. The two to three key strengths identified by the supervisor and me were that I actively participated in the debrief by asking pertinent questions, and I strengthened my communication skills in initiating conversations with the students at St. Madeleine. I also made sure that my communication was concise and very clear. It wasn't vague where I mumbled. The two or three key areas for growth or suggested change I had for myself were arriving on time. There was a day when I took the wrong exit in the freeway because I was distracted, which made me 30 minutes late. There were also days when I had to run to the room to be on time, which came off as unprofessional. Another suggested change I made for myself would be to be more of an active listener. Sometimes when the student was talking, I found myself getting distracted by my own thoughts instead of focusing on the student. Um, how did I respond to the feedback at the time? I had to meet with my academic advisor and professor who did a fieldwork contract with me to ensure that I maintained the professional standards. So for my level 1 fieldwork B for pediatric adult, which was last semester, the 2 to 3 key strengths I identified by my supervisor and me were that I asked critical questions and started asking more clinical slash critical questions. In the past, I would arrive to school on time, but it would take a minute or two to go to the classroom. This time, I arrived to the school earlier than usual, so I would be in the classroom before my shift starts due to the location being farther from my house. During treatment sessions, instead of observing without saying anything, I asked Brian Inglis, who was my supervisor, on why I think he was doing certain interventions. And I shadowed Lauren, an OT student on her rotation at University of St. Augustine on assessments, where I gave Lauren my observation on how certain students need to regulate themselves using appropriate acceptive feedback. The two or three key areas for growth were me being more comfortable with kids with behavior issues. I was exposed to a lot of kids who were born when their mom was addicted to drugs or alcohol, and sometimes the kids acted out due to being overstimulated and dysregulation. There are times when a child is yelling and I find myself accidentally raising my tone to de-escalate the situation, only it made it worse. Thankfully, my supervisor gave me good feedback on how that will increase the tension. The second key area of growth is learning how to be on the children's level. Most of the time, I would tower over the children by standing. Toward the end of the week, I learned that it's okay to be on your knees or sit down to talk to children so they can be more trusting and see me as an equal rather than authoritative figure. In what ways did it show progress compared to Fieldwork A, if at all? I showed progress compared to Fieldwork A by being early on time instead of narrowly arriving at the site on time, and took more of an initiative. I offered to assist the school OT and OTA by setting up the parachute to give the children more proprioceptive and vestibular feedback. How did I respond to the feedback at the time? The feedback I responded to mostly came from myself, and it was easier to absorb because I could see the impact of my actions or emotions on the children around me. For the community practice experience, what themes emerged from peer feedback, communication, leadership, or collaboration? The themes that emerged from peer feedback were that I tend to initiate the conversation by taking the first step when people did feel uncomfortable. For example, when we had to compose an email to a fieldwork coordinator, I offered to write a rough draft and had everyone fix it in the message. I also set a reminder for everyone, like clarifying upcoming events after class. Some gaps were that I would often leave early instead of debriefing initially, and I would be too eager to send things when people don't feel comfortable. Thankfully, I managed to overcome those challenges. The themes that emerged from supervisor feedback were that I they noticed how I was more comfortable working with horses and ponies by being more confident and proactive. I would constantly tell everyone that I would go take care of solely the pony. But looking back through all these experiences, for my strengths, I noticed I was much more proactive, communicative, and on time. For areas of growth, I found that I need to develop more of a confidence and being more comfortable with the discomfort. I did have professional behavior by wearing professional clothing during my fieldwork, maintaining patient HIPAA, providing culturally sensitive care, and respecting the patient's autonomy. My self awareness as an emerging OT changed over time by being more aware of how my emotions and physical actions can have an impact on people surrounding me. What surprised me was reviewing my past feedback. When reviewing my past feedback, I found myself more accepting and agreeing with the feedback. Even a year later, I'm still aware of my lack of consistent punctuality, and it's something I must willingly overcome. This is thanks to the self-awareness strategies I used in the past, like leaning into my discomfort, watching myself like a hawk, and not being fooled by a good or bad mood. My self perceptions align mostly with supervisor and peer perceptions. Sometimes I tend to catastrophize myself when I make a mistake, like not arriving on time and my supervisor notice. During sessions, I would constantly think about that and feel guilty that my supervisor is being disappointed in me, which affected the way I treated and interact with students. This definitely played a role in St. Manas Sophie Center, where I would often get distracted and not actively listen. However, I realized I tend to over focus on the negative aspects and I forget the positive feedback I get, which created a false imposter syndrome. The first concrete goal I have for Fieldwork level 1 experience will be arriving at the clinic early instead of on time. This goal is important for adult practice because when I arrive early, I have time to prepare and read the patient's notes. Sometimes when I arrive early on time, I'm in a hurry, breathless, and not as focused, which the patient will notice. I can measure/recognize progress towards this goal by writing out reminders on my phone when leaving at a specific time so that I can arrive at the clinic despite the heavy traffic. My second concrete goal will be having to use proper grammar when using documentation. When I write, I have a spelling check on, but my grammar makes my writing unprofessional with incorrect form. This goal is important for adult practice because it shows how I want to be treated as a professional alongside my interdisciplinary team. I can measure or recognize progress by using Grammarly and ask my supervisor on examples on how they will phrase the patient's progress during the assessment portion of the SOAP note. The third concrete goal I have will be asking my OT why they'll be using these interventions or exercises for this patient, and I will even suggest specific evidence-based interventions. This is important because it will allow me to build my self-confidence as well as provide valuable feedback on my thought process on how I can improve. I will read AOTA emails and look up the evidence-based interventions for specific upper extremity impairments. This will also lead into the discomfort, so when my intervention is not as effective, I can learn from my mistakes. I can measure my progress by how much the OT supervisor agrees with my interventions and gives me feedback. So the 2 or 3 specific strategies I will use to incorporate feedback through this fieldwork are using a weekly feedback action plan session. I will schedule a brief, consistent, and proactive meeting with my field instructor, perhaps in a start, stop, continue format. In this meeting, I will summarize my understanding after feedback from the previous week and specifically 1 or 2 actionable goals I will implement in the coming week. The second strategy I will use is a reflective journaling technique where I will document the specific behavior discussed and suggest a change and how I will apply it. At the end of each day or week, I will revisit the log to assess my progress, ensure feedback is not only heard but integrated in my daily practice, reducing the likelihood of repeating mistakes. The 2 priority competencies that I would want to be ready to demonstrate level 2 fieldwork will be intervention planning and education. Sometimes when I do assessments, I don't have practices implementing them, which can cause nervousness, unpreparedness, and unprofessionalism. I also do not have a lot of confidence in creating client-centered interventions, and this field will prepare me for those competencies by observing how evaluations and treatment work, being more confident in my interventions not working at first, and how I can improve on them. I plan to continue using this Fieldwork for myself and my supervisor as a lifelong learning strategy once I'm a practicing OT.